Is North Dakota in a bad place when it comes to the coronavirus? And why should we have confidence in a COVID-19 vaccine once it's approved? Today, KX News had the rare opportunity to present those questions and more to a member of President Trump's coronavirus task force. Here's part one of Josh Meny's interview with Dr. John Fleming.
For the last few weeks, surging cases of the coronavirus in the Midwest have been the story. Here in North Dakota, our rolling average of new cases around 300 per day, and hospitals are about as full as COVID-19 patients as they have been since the pandemic began. What needs to be done to drive numbers back down in North Dakota?
Josh, you know, the good news about North Dakota, South Dakota, and other states in that area is that really the outbreaks have occurred much later in those states than they did in other states around the country. We're well past what happened in the South and the Northeast. So I'd say that it's only now really arriving in North Dakota. But still, you're in what we call the yellow zone, which is between 5 and 10% positivity rates. Your death rates are only 2 per 100,000. So really, North Dakota, while you are seeing a bit of a spike right now relative to what's been going on in past months, you're doing relatively well. So again, what we recommend is that you get word out to the public to observe the important 3 W's, and that is wash your hands, wear a face mask, and certainly watch your distance. The importance about getting together in groups is to thin yourselves out, maybe try to meet if it's some social gathering outside, perhaps if the weather's still moderate this time of year. And be especially careful about those who are vulnerable, the elderly, people with comorbid conditions, diabetes, hypertension, obesity, etc. And really, those numbers should come down just fine.
The world is racing to get a COVID-19 vaccine ready. That process is moving very quickly, and some worry that politicians are putting too much pressure on drug companies to get a vaccine out soon. Here's my question. When a vaccine is officially approved and ready, why should North Dakotans feel confident that it will be safe to take that vaccine?
Well, Josh, that's the best question you've given me so far. It is true that the vaccines that we're working on will be rolled out in record time, just within months, less than a year, certainly. And there are a number of candidates out there, but we're actually developing them in parallel. We're testing while we're developing. And currently we have 3 candidates in final phase 3 testing, which requires 30,000+ volunteers. And most vaccines, we don't have nearly those kind of numbers in terms of volunteers. So we also have several committees, like the Safety and Data Committee, that are not affected in any way by political influence. They have no financial gain. They have no political gain. They have to sign off on it. The FDA, with its career scientists, they have to sign on it. Many have to sign off on these before they can be distributed to the general public. So while the president has put billions and billions of dollars behind this effort to remove a lot of red tape, we've not cut any corners. We've simply done things simultaneously. So we're actually manufacturing the vaccine while we're developing it, so that as soon as it's proven to be safe and effective, we can distribute it immediately to the American people. That's never been done before.
Now, tomorrow night at 6, our one-on-one interview with Dr. Fleming continues with a discussion on rapid testing and how the White House task force measures success in the fight against the pandemic.